Hello once again and welcome to Health Matters on Channels Television. It's good to have you join us. I am Mary Alale Yusuf. Chronic obstructive pulmonary disease, also known as COPD, is an underdiagnosed serious lung infection which has implications for breathing. WHO estimates that in 2004, 64 million people suffered from it, almost 90% of them in low and middle income countries. It is more common in men, but the women are catching up. The top health body says if there are no quick interventions to reduce risks, deaths from COPD may go up by 30% in the next 10 years. On the program with me is Dr. Cyril Chukwu, a consultant chest physician at Lagos University Teaching Hospital, Idi-Araba. You're welcome to the show, Doctor.
Thank you very much, Mary.
Now, today we're talking about COPD. But last week, a Liberian came into this country, suspected to have the Ebola virus, and he has now died. They confirmed that he had Ebola virus. What is the implication for us in Nigeria now?
Now, let's look at the people who come down with Ebola virus disease. They are relatives who cared for somebody who had the disease, healthcare workers who treated somebody who has the disease, laboratory workers who handled specimen, blood, urine, name it, from the patient, and sometimes mortuary attendants who looked at the dead body of. Now, all this points to one thing. You need close contact with somebody who has the disease. Touching the body, secretions from the body, vomiters from the body, or even feces from the body, maybe urine from the body.
So just being around the person.
Just being around the person, being in close contact. For example, if you live in Ibadan and there's Ebola in Lagos, it will not fly through the air and catch you in Ibadan. You need to be close and have touched somebody who has it.
Okay, so we shouldn't fear just yet.
No cause for alarm, no cause for alarm, except that we should all be on the lookout. If you have a relative that has fever, because it looks very much like malaria, fever, body pains, I think such a person should be taken to the hospital so that the hospitals will now look after. Because it is the risk that, oh, he has fever, you don't know that it's not malaria, and then by the time you know where you are, you have contacted it. So I think we should all be on the alert and then report or go to the hospital whenever there is fever, especially severe fever associated with bleeding. That is what gives it away. Fever associated with bleeding. Bleeding into the gums, bleeding under the skin, bloody diarrhea. If you have any relation with that kind of symptoms, I think this should be best taken to the hospital.
Okay, but what if an Ebola sufferer has sat on a chair, for example, and his sweat has touched it? And, you know, somebody comes in maybe a day or two later, sits there. Could it be a problem? Because you can't be sure where he has lain or sat.
That is true. But the good thing about the virus is a very delicate organism. It hardly survives outside its host. So sitting on a chair and then 2-3 days later you come and sit on the chair is unlikely. The virus would have died, would not be able to survive on a chair for that length of time. So
we're talking, be on the lookout. That's what it means.
Be on the lookout.
Be careful, fever, any bleeding, personal hygiene.
Wash your hands, and then if you can wear gloves, better. Gloves. If you can't, then wash your hands. But there's really nothing to panic about.
Thank you very much. That's very comforting. Now let's go to COPD. We've already said that COPD happens in the lungs. Is that the only place it happens?
It is primarily a disease of the lungs. But the lungs are not hanging out there all alone. The body is all integrated as one unit with different components. So a disease of the lungs can affect the heart because the heart and the lungs work together. Once the heart is affected, the liver can be affected, then the legs. In other words, COPD can affect all parts of the body, but it starts from the lungs.
Okay, what does it do to the lungs exactly? Does it harden them? Does it perforate them? What really does it do in there?
The business of the lungs is to transfer oxygen to the body. That is the primary purpose of the lungs. Transfer oxygen to the body and remove carbon dioxide from the body. So, all lung diseases, including COPD, interfere with the ability of the lungs to perform their function. In other words, COPD will prevent oxygen from getting into the body and also prevent carbon dioxide from coming out of the body.
But is it hardened? Are the lungs hardened, or are they perforated, or something else?
No, I will not use the word perforated. Maybe hardened is close to what happens. Hardened may be close to it, but we don't use the word hardened. We have medical terminologies.
For that.
But the end result is that oxygen is not able to get in.
Come in, and
carbon dioxide is not able to come out as fast as it should.
What is the cause?
Cigarette smoking. 9 out of 10 people who have COPD would have been heavy smokers. So smoking. Now, the remaining 1% may not be smokers, but have been exposed to smoke, domestic smoke.
Oh, not even cigarette smoke?
No, domestic smoke. Now, the good thing is that in most villages where we use firewood, this is sometimes done outside, not inside. But during the rainy season, and in some parts of the world where it is very cold, most of the cooking is done inside. So they're exposed to smoke from firewood, from coal, from kerosene, if you are exposed to smoke for a long time, then you have the disease. Now, when you have polluted environment from machinery, this engine doing this, and you have fog, yes, they're also more predisposed. But you can argue that how often do you stay outside? But cities that have a lot of smoke, a lot of fog, people who stay outside most of the time are also predisposed. So the bottom line is smoke, whether it's from cigarette smoke, firewood smoke, machine smoke, from diesel smoke, or molue smoke. Once you are appreciably exposed to smoke over a long time, it damages the lungs.
So are some people predisposed genetically to get?
A very small number of people have low levels of an enzyme. And those who are deficient in that enzyme are predisposed. But that's a very, very small percentage. And they're usually children. It's a very, very small
And can this percentage be treated to have a kind of supplement or a kind of compensation?
Oh, yes, it's quite possible. It's quite possible if they're identified early.
Now, this is a problem of the lungs.
Yes.
The doctors know that when they examine the patient.
Yes.
But what does somebody see about the patient? What symptoms show up that points to COPD?
Okay, the main symptom is cough. And this cough is not a cough that has lasted 2 days. No. They say if you cough most times or most of the days for more than half of 2 years. In other words, in 2 years, you are coughing, and you are bringing appreciable quantities of sputum. That is the type of COD we call chronic bronchitis. That is mostly cough. The other extreme is emphysema. Cough is not that pronounced in emphysema. Not that they don't cough, but the main thing there is that they are breathless. Because in chronic bronchitis, mucus, that is phlegm, is high. Whereas in the other extreme, emphysema, is the barrier that oxygen passes through and carbon dioxide passes out of the body that is damaged. Because that barrier is damaged, oxygen is not able to go in as fast as it should, then they get breathless. So, you now see that most patients with COPD will have a combination of cough and breathlessness. Those who have more of chronic bronchitis will have more of cough,